My name is Jasper Vleugels. I'm a PhD candidate in the Academic Medical Center in Amsterdam, the Netherlands, and I am happy to discuss our publication in gastrointestinal endoscopy. The title of our publication is The Natural History of Diminutive and Small Colorectal Polyps, a systematic literature review. In an earlier landmark study, which compared different surveillance intervals after polypectomy, colonoscopy with removal of all visible lesions and subsequent surveillance reduced morbidity and mortality of colorectal cancer by approximately 50%. Unfortunately, it is unknown whether removal of all diminutive and small polyps contributed significantly to this reduction. This information is essential as between 70 and 90% of the detected polyps are sized less than a centimeter. The risk that these polyps contain advanced histological features associated with future colorectal cancer is low and ranges between 0 and 4.3% for diminutive polyps and between 1.1 and 13.6% for small polyps. The risk of cancer within diminutive polyps is very low and ranges between 0 and 0.1% and between 0 and 0.4% for small polyps. In recent years, more and more diminutive and small polyps are detected during colonoscopy due to ongoing improvements of endoscopic imaging quality. Currently, all detected polyps are removed, even the very small ones. However, the chance that these progress to colorectal cancer is not well understood. Hence, this raises the question whether removal of all diminutive and small polyps is necessary to prevent cancer in the future, or that these can be left without resection. The aim of this systematic literature review was to explore the natural history of 1 to 9 mm polyps in patients that were not treated with polypectomy and underwent follow-up. After registration of our protocol in the PRISMA database, we carried out a systematic electronic search under the supervision of a medical librarian in Medline and Embase. We combined several relevant keywords to construct a search strategy. To be eligible for inclusion, studies should prospectively assess patients with 1 to 9 mm polyps that were not treated with polypectomy and underwent follow-up. We did not restrict for publication date, and we independently extracted data in a pre-designed datasheet and assessed the quality of the studies using the Newcastle-Ottawa scale. From our search, we retrieved 8,775 studies, of which 9 fulfilled the inclusion criteria. In these studies, a total of 1,034 adenomas were prospectively observed in 721 patients. In 7 studies, the average duration of observation was 2 to 3 years, and CT colonography, barium enema, and endoscopy were used as observation methods. In 3 studies, a tattoo was placed adjacent to the polyp to ensure redetection. Biopsy prior to surveillance was performed in 2 studies, and in 1 study, the endoscopist used the Cuda pit pattern to diagnose the histology of the polyp prior to observation. In all these studies, 1 small rectal polyp detected with CT colonography possibly progressed to colorectal cancer. 1 patient had a growing pedunculated polyp at a 2-year surveillance CT colonography, but was lost to follow-up. 5.5 years after the index CT colonography, this patient returned with a symptomatic invasive cancer at the same site. Of 1,034 adenomas observed, only 6% progressed to advanced adenomas over time. For the natural history of serrated polyps, no further insights could be extracted from these articles, except that distal hyperplastic polyps remain stable during observation. Several limitations of our systematic review and the articles included have to be acknowledged. Overall, the mean follow-up of all studies was short and exceeded 3 years in only 2 studies. this time frame might be insufficient to draw any reliable conclusions on the long-term development of polyps. In addition, the number of polyps observed per study was relatively small. Furthermore, without the tube placement adjacent to the polyp, redetection of the initial encountered polyp was unreliable. And when biopsy of the polyp was performed at the time of diagnosis, this could have altered the natural development by removing the polyp partly or maybe even in total. However, these data are the only available data on the natural history of diminutive and small polyps, and the results of these studies uniformly indicate a rather indolent and benign course of 1 to 9 mm adenomas. Although this only applies to a very short follow-up of 2 to 3 years for the majority of studies. Whether we should leave 1 to 9 mm polyps unresected when detected remains a difficult question to answer, except for the diminutive hyperplastic polyps located in the rectus sigmoid. Before this can be endorsed, further understanding of the natural history is needed as a basis for future surveillance practice. New natural history studies could provide long-term follow-up data of high quality. However, the natural history of 1 to 9 mm polyps can only be studied when leaving them in situ during colonoscopy, and both patients and gastroenterologists might be reluctant to participate because of ethical issues. But to further enhance and refine colorectal cancer screening and surveillance programs, more data on the biological significance of these 1 to 9 mm polyps are eagerly awaited. Thank you for your interest in our work, and if you have any questions or if anything is unclear, please do not hesitate to contact us.